just continue to wait to see if they can get a product done. But at some point in the process, there's going to have to be a conclusion that either they can get a bill done or they can't get a bill done. And my commitment to the American people is to get a good product which will include Republican ideas, but I have no control over what the other side decides is their political strategy. And my obligation to the American people says we're going to get this done one way or another. All right? All right. I'm going to... You guys have been to my town hall meetings, so you know I always go boy, girl, boy, girl. So, all right.
Good afternoon, Mr. President. My name is Teresa McRae, and I am from Virginia, another state that flipped from red to blue. I live in Spotsylvania County, and it's a rural county, but when I talk to people as a community organizer for OFA, it all comes down to money. And I may suggest, well, there's long-term benefits and the quality health care, but they come back to me and say, well, what's going to stop people from being in their employer-based health care and just quickly move over into the government health care? And who's going to pay for it? What do I say?
Okay. Well, it's a great question. There are a couple of issues involved here. The first issue is, how are we paying for health care reform generally? Now, one thing that's very important to remind people, because you notice there's been a talking point from opponents, $1 trillion health care bill. They love repeating that, $1 trillion health care bill. First of all, it's important to remind people that when they say $1 trillion, they're talking about over 10 years. So we're talking about $100 billion a year, which is still a significant amount of money. But just to give you a sense of perspective, I mean, the amount of money that we're spending in Iraq and Afghanistan is, what's the latest figure? Debbie, you figure $8 to $9 billion a month, right? So for about the same cost per year as we've been spending over the last 5 to 6 years, we could have funded this health care reform proposal. Just to give you a sense of perspective. That's point number one. Point number two, about 2/3 of the costs are actually going to be paid for from money that's already in the health care system, the taxpayers are already paying for, but is not a good deal. So it's reallocating money that's being wasted right now, taxpayer money that's being wasted right now, and using it in a way that actually makes people healthier. That's point number two. So remember I told you about those subsidies that we're providing to insurance companies? That's an example. Another example is the way we reimburse hospitals right now. We don't incentivize hospitals to get their patients the best treatment the first time out. Because if a patient is immediately readmitted, well, we just pay them the same rate as they were the first time. Now, think about if your car needed repairs and you sent it in and got fixed, you thought, a week later, the same thing breaks down. When you went back to the auto shop, you'd probably want them to give you a little discount on fixing it the second time. But we don't do that right now with respect to hospitals. And those are the kinds of changes that we can make that would pay for about 2/3 of the cost of health reform. That leaves 1/3. And we do have to pay for that. I actually think that we're going to get even more savings with prevention and wellness. But unfortunately, we can't count that. It's not in congressional lingo scorable. We can't. Nobody gives us credit for it because it's not provable how much money we'd save on those things. Even though everybody understands that the investment we're making in prevention and wellness and health IT are going to make a difference. So a third of it we're going to have to pay for. And what I've proposed was that we would pay for it by having people over $250,000 a year have their itemized deductions go to the same rate as everybody else's, 28%. Right now, they get more because their marginal tax rates are a little bit higher. And if we just went back to their deductions that existed under Ronald Reagan, that radical, then we could pay for all of the health care reform that we're talking about. Now, there are other ideas that are being floated out there, both in the House and the Senate. But the bottom line is what we're really talking about is about $30 to $40 billion a year that we've got to come up with. And I am absolutely committed, and you can say this to people, the President is absolutely committed to making sure that that is not funded on the backs of middle-class families. We're trying to help middle-class families and give them additional resources to get health insurance. We're not trying to add to their tax burden. Okay, so that's very important. Now, there was another question that you asked, though, and that is, how do I know that my employer is not just going to dump me into the public plan? Well, there are actually provisions in the law that say if your employer is already providing you with good health insurance, then you can't just send your employee over into some sort of public option. It's what's called a firewall. And so there are provisions to prevent that kind of shift. Now, there are going to be a lot of employers, small business owners, who immediately are going to qualify for signing up for the health insurance exchange, because right now they can't afford to provide their health insurance to their employees at all. And we want to make sure that they are getting some help. Partly because small businesses, they don't have any purchasing power when it comes to insurance companies. You know, if you've only got 5 employees or 10 employees or 15 employees, and you go to an insurance company and say, I want to get a good insurance policy, they're not going to give you a great deal compared to if Xerox shows up with its thousands of employees. And so when a small business joins this plan, they are going to be able to pool their purchasing power with all the small businesses and individuals out there who don't currently have health insurance. And that will help drive down costs. Okay? All right. Who's next? This gentleman right here.
Thank you, Mr. President. My name's Michael Perlmutter. I'm from Durham, North Carolina. I'm the co-chairperson of Durham for Obama's Healthcare Committee. We have 11,000 members.
Great.
And all of my volunteers say the same thing. They're behind reduced costs. They're behind guaranteed choice. They're behind healthcare for all. And they believe, and I believe, that the only way to do this is to guarantee a public option available to anybody who wants one. And my question is, if that's the solution that you believe in, why aren't we pushing it harder? And if that's not the solution, what other solutions out there would accomplish all 3 goals that you have?
Well, it's a great question. And, this is an example of sort of a controversy that has been somewhat manufactured this week. So let me just be clear. I continue to support a public option. I think it is important, and I think it will help drive down costs and give consumers choices. The only thing that we have said, and this continues to be the truth, and I mean sometimes you can fault me maybe for being honest to a fault, is that the public option is just one component of a broader plan. So let's just use the example of making sure that insurance companies are treating their customers right. One way that we're doing this in this health reform bill is very directly through insurance reforms. We're saying to them, you have to take people with pre-existing conditions. You cannot have caps on lifetime expenses or yearly expenses that people bump up against and suddenly have to pull out a lot of money out of pocket that they may not have. So we're putting in place a whole bunch of insurance reforms that regulate the behavior of insurance companies. Now, alongside that, if there's a public option that is also offering a good deal to consumers, then the insurance companies have to look over their shoulder and they say, gosh, if the public option is